Hey guys, welcome back to my channel. Happy Monday to everybody. I wanted to start today by talking about how you might be able to discuss the coronavirus with your children because it's something that's come up more and more in my household as people are becoming more aware. Now, I have kept my children very informed because I want to keep them as safe as possible. So, as a parent, of course, this is a personal decision how much you do or do not want to tell your children. But for parents who do want to sort of arm their children with some information, I just wanted to go over. I think I have like 8 or 10 different little talking points. If you see me looking down, it's just so I don't get off track. But I wanted to give you some pointers and some things that I have found very helpful in our household. So, obviously, if you're talking about children under 5, there's really no need to discuss that with them except to maybe encourage them to use better precaution as far as like putting their hands in their mouth and things like that. But since you have really good and tight control over children in that age group, it's probably less of a concern. So my children are 9 and 10. Of course, they're still going to school. We live in Louisiana. So as a result, I have to keep them safe. And the only way that I can do that is to arm them with knowledge. The very first thing to talk about with them is just to tell them what a virus is. What is the coronavirus? It's a family of viruses. We have 7 that we know about. And if you guys want to watch videos to maybe help you discuss this with them, I shot a whole series of videos. I think it was 2 weeks ago now, and I'll put the information card right here, and it was talking about pandemic definition. So I think with children, well, with anybody, but certainly with children, if they have a good understanding of what you're talking about, I think that kind of takes that fear factor away. Of course, you have to handle that conversation diplomatically, and how you want to do that is, of course, going to be up to you. But for me, I explained to my children, I took a little pin and, a little dot, and I said, it's so much smaller than X, and that's why we have to be so careful because we can't see it. We cannot see it with the human eye. And as a result, we don't know where it is. So we have to exercise a higher level of caution than not. And then I also went over with them what the symptoms are, what this virus actually does, and not to get into a too technical conversation about it, but basically that it affects your respiratory system and, gets deep down in your lungs and causes a whole host of complications that none of us want. So maybe just having a conversation with them about the basics of what the virus does. Again, I would refer to those definitions because it will probably be very helpful for you. All right, point number 2 is transmission. How can they keep themselves safe? My son asked me this morning, can it get in through your eyes? Absolutely. There is definitely at least speculative proof at this time that transmission can come through your eye membranes. So, and that's a tough line to walk because we do have to send them out into the world, and I just touch my face, which I tell them not to do. We do have to send them out into the world, but we do also want them to be aware of the ways in which it can get into their eyes. So I did explain, yes, it can get in through your eyes, your nose, your mouth, your genital area. The biggest risk at this time is picking it up, touching something, and then touching your nose or rubbing your eye. So really have stressed the importance of making sure to do that, 30 seconds of hand washing. And I shot a video about that last week too, and I'll try to put the information card here. We made up like a little jingle to help them remember all the parts of their hands that they need to wash. So just really going over good, solid hand hygiene, and then making sure that they have hand sanitizer with them in case they don't have access to a restroom to maybe wash their hands. And specifically just telling them, guys, this is not the time for extra hugging and high-fiving and all of that. There will be a time and a place for that, but it's not now. So right now we need to be more protective, more careful than not. So, keep your grubby little mitts off of each other. And if you touch something that seems like it might be a questionable surface, like a bathroom handle, or basically anything that has constant contact with other people's hands, that's when it's time to break out the hand sanitizer. You're not going to hurt your children by telling them to be safe and to exercise a higher level of caution. Number 3 is protection. So I did explain to them that as we go forward in time, some of the things that might come to pass, and again, might, and I was certainly careful to stress that, things like face masks, eye goggles, gloves, potentially even a full suit. Now, for myself and my family, if anyone had to leave this house, it would only be me. I mean, ideally, you would have one designated adult that leaves to go get provisions if necessary. Now, I have encouraged, and we have certainly done in my house, prepared, stocked in enough food and over-the-counter medication, which I will be filming a video about later this week, so that we don't have to find ourselves in that situation. But if you do, I was explaining to them, if we did have to go into public and this situation progresses on the track that it is moving, those are some precautions that we may have to take. Now, to have that conversation with a child, is that frightening for them? It could be, but it's a lot less frightening than all of a sudden saying, hey, you have to wear a mask and gloves and everything else. At least this way they know, hey, this may come to pass. And if it does, it's only to prevent transmission. And so that's what we're doing here. All right. What could happen? We have had this conversation in droves. What could happen if Louisiana healthcare systems become overrun? What could happen if there were civil unrest? I have talked through all of those plans with my children. Now, again, it's a personal decision how much you want to explain to your children. But for me and my family, I'm going to make sure to arm them with everything that so that they are aware in advance. They're not playing catch up and they don't have to mentally and emotionally adjust in the middle of a situation. I want them to know, hey guys, this is what could come to pass. God willing, it will not, but it could come to pass. And if it does, here is the plan. This is what we're going to do. If schools close, if I can't go out of the house to go to work anymore, if we potentially had to leave our home and go to another location, they know all these things now, so there's no fear in that. Now, this is also a great time to use this as a learning opportunity for your children. So I have explained to my children, what is the CDC, the Center for Disease Control? What is their authority and responsibility in this situation, which is to protect the public health in the United States? And I'm not speaking for other countries. Generally speaking, that would be the role for your central public health office, public health outfit. But in America, that is their role, okay? And they have powers that they can wield in an attempt to control and protect public health. I've also explained to them who the WHO is, not the band, but the World Health Organization, what their responsibilities and roles are, which is to provide tactical advice, recommendations to member states, and to help everybody globally address this concern. So it's a great learning opportunity. I've definitely had discussions with them about what a pandemic is and kind of explained to them what the 1918 pandemic looked like, what happened during that time. I've also explained to them, to make sure to quell any fears, it's a different situation now. We have better medicine. We don't particularly have medicine for this, but we have better medical facilities. We're in a better position. Unfortunately, we also find ourselves in a much more interconnected environment. So I have explained the balancing act that is going to happen here with respect to slowing it down and the influx on our medical system in very general terms. I mean, if you're talking to children, you don't need to read them, they don't have to go to a college course about it, but it's important for them to understand, hey, this is why we will attempt to treat at home, because we don't want to find ourselves at a hospital, which is potentially overrun with infected people. So we're going to treat at home as long as humanly possible. And here are the ways that we're going to do that. We're going to monitor our vitals. Again, I filmed a video about this last week. I'll try to put the card here. And that was about the 4 vital signs that you can monitor at home. So you don't have to run to the hospital. And that was thermometer, blood pressure cuff, pulse oximeter, and there was another one I can't remember, but I'll put the card right here. Very useful. You do not want to find yourself in a hospital if maybe you're just suffering from anxiety or the regular flu and you don't have respiratory complications or other complications that warrant medical attention. So keep yourself out of that environment if at all possible. All right, this is a wonderful opportunity to teach your children about geography. So I have shown them the world map. We've discussed, this is what's happening in the epicenter. This is what's happening in the little epidemics that are happening in Italy and Iran and now, unfortunately, many other countries. And also, I've shown them the map of the United States and how it's sort of filling in as this community transmission happens. And we've had conversations about that. So this is a great opportunity. I mean, nothing is all bad, and in no way am I implying that the coronavirus is good. I am not. But what I'm saying is, as a parent, you can use this as an opportunity to discuss with your children geography, okay? We're in Louisiana. Here we are. There are cases in Texas. There are cases to our right. There are cases to our north. So obviously, they were even able to understand that at some point in the likely very near future, probably during the week that I'm filming this video, which is 9 March 2020, that we will likely have cases here. In fact, if I'm being completely honest, of course, we have cases here already in Louisiana. We just had Mardi Gras, which, 1.5 million people come from all over the world and bring all kinds of stuff with them. And so I think it's very, very likely that we have cases circulating here. We just don't know about them. We've only tested 8 people. So, can't have cases if you don't run tests. And I love that apparently we're going to see that testing increase as time goes forward. And to the end about geography and the map, where is this virus currently? And I've explained to them our current threat, right? We have, I think it's like 26 students who just returned and teachers who returned from a trip in Italy. Now, it's my understanding that they were in the southern portion of Italy, and of course, the epicenter, it was not an epicenter, but where their outbreak is occurring is in northern Italy. But that those people came back to America, they were asked to self quarantine, but unfortunately, their family members do not have to self quarantine. So they're just out and about circulating in the area. So there is a risk present for everyone. I don't care who you're listening to. Good common sense tells you that there is a risk. What I am saying is that there is a higher likelihood, a probability that it is in your state and potentially even in your town than not. Unless, Louisiana went and we put a giant Ziploc bag over the state of Louisiana, which we didn't. Nobody has done that. So I think it's good measure to make sure that your children understand there is a credible risk present and you need to protect yourself from it. Okay, their feelings. And this was a really important one because they had a lot of mixed emotions. Some of it was, wow, this is kind of fascinating. Some of it was, wow, that's really terrifying. And guys, I mean, yes, it's our job to protect our children's innocence as long as possible, but it's also our job as parents to make sure that we do our part as parents so that they can do their part as children and reduce the risk of transmission to adults. Because as we all know, the coronavirus seems to spare children, which is the best news possible. But unfortunately, if children are going to an environment where they're little, it's a little petri dish and everybody potentially, not everybody, but that there is a lot of exposure, that those children could bring that risk home. So I've explained to them, it's not just about you protecting yourself. It's about you protecting mommy and any other adult that you may come into contact with. So you have to do your part. And that helps them to feel empowered. But definitely having a conversation, an open and honest conversation. This is not a time, for pie in the sky, unicorns and fairy dust. And I love all of those things. But we find ourselves in uncharted territory, in a place where we're going to have to ask some pretty serious questions of ourselves as parents and identify for ourselves how we want to equip our children. So this is for people who want to do that. Look, I'm sure that there will be comments down below, people saying, oh, that's fear mongering and you're telling your children things that they don't need to know. And that's fine. Again, personal decision for me and my family. This is what we're doing. If you don't want to do that, I'm not telling you to do it. I'm just telling you, hey, here are some talking points if you want to talk to your children. Their concerns. What are their concerns? What are they worried about? Like my daughter asked me, oh, well, I want to graduate the 5th grade. I don't want to miss the rest of 5th grade and have to redo it. And I explained to her, this is not a concern. We would go to online school. So you would have the exact same curriculum, homework, and you would just do it at home. Of course, there was just great sadness that washed over her when I told her that. That this would not mean a departure from school as she knows it, just means that she would be learning from home and not at the school. So it's important. Kids have concerns about things too. They're people. They're walking around with their own set of understanding of the world. And when you ask them to shift that reality, there are going to be concerns. And it's important and valid to address those concerns with them. And then the very last thing that I have taken the chance to discuss with them is what would happen is if we were asked to quarantine ourselves. First, I explained to them what quarantine means, that we would be asked to keep ourselves at home. And why we would do that, I explained R naught to them, that this is the transmission, one person, if the R naught is 3, that one person could give it to 3 people. And that's why self-isolation or quarantining is so important, because we have to get that R naught down so that we don't have this massive surge of people coming into our hospital systems. So I explained that whole basic thing. And again, I would refer you to those definitions that I mentioned, that series. I think it was an 8-part series that I shot. And I asked them if that came to pass, and I said, that's an eventuality we may have to face, and if it is, we'll face it together. But if that happened, what would you want at home? What would you find comforting? Are there any particular snacks that you would want? Are there any particular activities that you may want me to buy supplies for? And that made them feel much better, that they felt that they had a say in what potentially could happen, and that they were going to feel prepared. So all of this is done in an attempt to calm them down, because You may think that your child only knows X, Y, and Z, but my children have come home and told me stories of things that are circulating at the school, stories that are being told, oh, if you get this, you're going to die for sure. And of course, no child wants to believe that. And so it's important to just let's break it down. Let's tell them, hey guys, yes, here's the math of if 100 people have it, 80% of those people are going to have mild symptoms, and then the other percentage are going to have serious or critical complications, and that unfortunately that there will be fatalities. I think that is important for them to understand, because I wouldn't want my children to suddenly find themselves thrust into the middle of a situation where they're going, why are people dying? I don't understand. I'm afraid. So explaining to them how they can keep themselves and their family members safe, what the plan is, what things may look like as we go through this situation, makes them feel a lot better. Guys, tell me in the comments below, what do you feel comfortable telling your children? Are there any things that you want to share with the rest of the community, things that maybe you think it's important to share? All right, well, that's going to do it for this video. If you enjoyed it, please consider leaving a like, a comment, and if you have any questions, of course, leave them down below. If you want to be notified when I upload new videos, just go ahead and click subscribe and then hit that little bell notification. None of these videos are monetized, guys, because none of this, I was talking to my girlfriend the other day, and we were discussing what a departure this was from the kind of stuff that I normally do. And she said, but yeah, I get it. This is your passion project, because I think we all kind of feel a little bit like grabbing at straws. Like, what are we supposed to do right now? And for me, this is what I feel compelled to do. I have a platform, I have a camera, and it would seem somewhat irresponsible for me to put together information and then not share it with other people, especially parents, for this video. We're all struggling with that. What do we do? How do we talk about the elephant in the room before that elephant is in our house? So that is what this video was for. I really hope that it was helpful for you. If it was, please feel free to share it with other people, and I will see you guys in the next one.